Good morning, everybody, and assalamu alaikum. It's actually my pleasure to be here today, and I'm very grateful for the organizing committee of this conference and for Lily team, and I'm really grateful to my colleague from Ambulatory Healthcare Services to come here in the morning and support me. Today, I'm going to talk about actually the legacy of baricitinib in treating atopic dermatitis and alopecia areata. Before starting, I would just like to mention some housekeeping guidelines.
Dear colleague, my name is Dr. Lamia Rizvi, and I'm the Associate Vice President of Medical Affairs at Sameta at Eli Lilly and Company. Welcome, and thank you for dedicating your time to attend the meeting organized by Lilly today. At Lilly, we are committed to following both the letter and the spirit of the laws, regulations, policies, and procedures that govern the pharmaceutical industry. We would like to remind you that today's discussion will be dedicated only to information that is consistent with the product label that is approved in this country. Any questions relating to unapproved drugs or unapproved indications, dosing regimes, populations, or other information which is not consistent with the label will not be answered in this meeting, but forwarded to our medical department. Thank you for your understanding, and I wish you a good meeting. And I sincerely hope that the topics discussed today will bring learnings that will be useful in your everyday clinical practice.
So, we all know that Olumiant is the brand name of baricitinib, which is a very selective oral JAK inhibitor for JAK1 and JAK2 that has been used for a while for moderate to severe atopic dermatitis in adults and also severe alopecia areata in adults. I have no conflict of interest, and this presentation is being sponsored by Lilly. So, Olumiant or baricitinib for moderate to severe atopic dermatitis has been approved for pediatric who are suffering from atopic dermatitis, moderate to severe, and it is being approved for the age of 2 years and above. As we all know, also it was approved for severe to moderate atopic dermatitis and severe alopecia areata in adults. It is the first JAK with both atopic dermatitis and alopecia areata indications, and it is the first and only JAK approved for patients with atopic dermatitis at the age of 2 to 12 years. It is available in two forms. It is in 4 milligram and 2 milligram for patients with atopic dermatitis and alopecia who require an adaptive treatment. So it has also demonstrated sustained long-term efficacy in patients with moderate to severe atopic dermatitis and patients with severe alopecia areata. Also, it has a consistent and well-established safety profile across all indications for in dermatology and also rheumatology. So why we are talking about atopic dermatitis and why we need more of persistent and more of effective treatments in this. We all know that atopic dermatitis has negative impact on several aspects of quality of life of patients, whether it is adult, children. So if we go for the negative impact of alopecia areata on the quality of life of adults, we can see that 54% of patients will report itch, and this itch is the burdensome symptom in their presentation, while 81% will suffer sleep disturbance because of the persistence of itch, and there are around 68 hours of working are affected or lost with patient having alopecia areata. There are 61 reported patients reporting skin pain when having the flares or when they're having moderate or severe atopic dermatitis, and 82 are worried about their appearance, especially if they are working in contact face-to-face with clients and customers. And there are 25% of patients representing or reporting depressive symptoms when having the flare or when having their atopic dermatitis. What about the effect or the negative effect of atopic dermatitis in children? There are 65% of children who are reporting that they have itching on daily basis, everyday itching. And 79%, they are suffering from sleep disturbances. And there are 32 who are losing school productivity, and even they are showing bad performance in academic career when they are having severe or moderate attacks of atopic dermatitis. Around 46% of patients of pediatric, they are having skin pain, and actually a good number, they are suffering, 27% suffering from being bullied at school by their colleagues, and this will actually attract them to have more of depressive symptoms, as being reported that it occurs among 1 to 3 patients of atopic dermatitis. It's not only affecting the patient himself, whether adult or children, it goes back to affect even the family. And from different studies and observational studies, they found that mothers of children suffering from atopic dermatitis, there is increased need or increased risk of having more prescriptions for depression and anxiety, pain, and sleep problem. And there are areas of the family life which is most being affected. This includes expenditure, tiredness, family sleep, and caregiver quality of life. Atopic dermatitis burden in children who are less 12 years with moderate to severe extended to family and caregiver, demonstrating that there is an additional impact of inadequate disease control, and there are unmet needs that to be fulfilled for effective and safe therapies. And actually, we can see this in our daily practice when in our clinics, that the mother are complaining they are not sleeping when the babies are having these attacks, and they have to wake up with the baby or the child when they have the flare, and actually suffering even of loss of their working days, both parents. So now this is the good news that it's been approved in UAE as the first systemic therapy treatment approved for pediatric patients from the age of 2 years. And it is being approved for pediatrics for having atopic dermatitis, for moderate to severe atopic dermatitis, who are eligible for systemic treatment. So we know that any treatment is being launched or approved, it will pass through medical clinical trials to be approved after that. BREEZE-AD study was done to evaluate the safety and efficacy of baricitinib in the age of pediatrics from 2 years. So after a washout period, there are 3 arms for the medication. Bari 4 milligram, Bari 2 milligram, and placebo, and this was evaluated until 6 weeks, week 16, and the primary endpoint was to have EASI score and RNS for itch. So patients who completed week 16 can either enter the long arm extension for up to 4 years. If we can see here the improvement in EASI 17 and EASI 75, and EASI 90 response rate were improved with Bari high dose versus placebo through week 16. So we can see from here that at patients who are receiving Bari 4 milligram, they reached up to 52.5 responding rate in comparison to placebo and 40% at week 16, while when patient who reached easy 90, they were 30% who are receiving Bari 4 milligram and 21.7% for patients receiving baricitinib 2 milligrams. So more patients also reported itch improvement in numerical rating scale, having improvement in more or 4 or more point improvement with Bari at high doses versus placebo. And we can see that these patients are age 10 and more because this test actually is being done based on patient questionnaire. And we can see that 35.5% of these patients reached responded for a numerical rating scale more 4 and more point improvement at week 16. Of course, before launching any medication, the treatment emergent side effects and whether the severity of these side effects should be evaluated for and compared to placebo. And from all these numbers, we can see that there isn't that safety profile of Bari in pediatric, whether at 4 milligram or 2 milligrams, and the treatment emergent adverse events are very minimal in comparison to placebo. So, Olumiant or baricitinib can be dispersed in 5 to 10 millimeters of water for pediatric patients who cannot swallow the tablet. And it can be given in a dose of 4 milligrams or 2 milligrams based on the pediatric weight. So if the baby or the child is measuring more than 30 kilograms, then 4 milligrams can be given to the child. And if it is between 10 and 30, 2 milligrams can be given. And it can be given with or without topical steroids, can be given as one-day dose, and can be taken with or without food. For adults, the recommended dose is 4 milligrams, and 2 milligrams can be given in special conditions when patient is susceptible to venous thromboembolism, or there is percentage of MACE or any chance of having malignancies, or if the age is more than 65, and if patient having any other indications or chronic infections, so it is better to start, or he is on any other treatments that like rifampicin or other medication that can interact or increase the level of baricitinib. So even after these restrictions or contraindication for 4 milligrams is over, patient can go for 4 milligrams of medication. What are the lab tests needed to be done before initiation of Olumiant? These blood tests are similar across all indications of baricitinib. This include baseline tuberculosis, TB test, hepatitis profile, CBC differential, hepatic transaminase, ALT and AST, lipids, and renal function, especially creatinine clearance. This can be repeated over during the course and at 12 weeks. When we have to stop or do not start the medication, when liver enzymes are elevated, and we are not sure if the patient have any damage from the treatment when it is initiated, then it is better to stop the medication, refer patient to gastrology, and only get the permission from gastrology to resume back the medication. Another time when, another indication, when there is active infections or serious infection patient having, and if hemoglobin level is below 8 grams per deciliter. Per liter. So we are going to spotlight on itch and how individualized medicine can help make decision about in treatment of atopic dermatitis. We know that itching is the leading symptoms in atopic dermatitis, and in multiple studies and multi-center studies, it was demonstrated that 85.8% of patients with moderate or to severe atopic dermatitis, they are reporting daily itch during the course of their disease. 60.5% reporting severe or unbearable itch in the course of the disease, and 54.5% of patients reporting having itch as their most troublesome symptom. Having itch as a leading symptom in atopic dermatitis will lead to difficulty in falling asleep. Patients will wake up multiple times during night for itching, especially when they are getting warm. And there is a significant impact on the quality of life of patient. Scratching, which results in further skin damage, will lead to more of itching and more of making the patient having different skin infections, especially viral and bacterial. So itch also causes sleep problems, as we mentioned, and this actually, because of itching, reported to be more during nights and evening. Patients who are involved in the studies, they showed that 38.2% of such patients, they have itching more at night, and 52.8% having itching during the evening. And the most intense itching was experienced the evening and at night. 80.9% patients were reported to have difficulty in falling asleep due to itch. So the phenomenon of itching often being most intense in evening and night is also connected with the problems falling asleep or awaking during the night. In a questionnaire done for different patients to assess their need and what are their targets in treatment targets, 96 of the patients, they reported that they want to be free of itch. Others reported to have a better skin look. Others no longer having burning sensation on their skin, and some again reported that they want to regain control of the disease. So from this questionnaire and this treatment goals of the patient, we can see that many patients with moderate to severe atopic dermatitis are undertreated, and despite the availability of systemic treatment, more than 50% of patients still experience large impact on their quality of life. So the BREEZE AD7 over 16 weeks, having Olumiant in combination with corticosteroid showed rapidly and significantly increasing the proportion of patients achieving EASI-75 versus placebo. And we can see here from this that 48% of the patients on Olumiant 4 milligram in combination with topical steroid, they have marked improvement at week 16, and this improvement started as early as week 2. And if we see the effect of baricitinib in combination with topical steroid on itch, we can see that itch improved as early as day 1 at the first dose. And from the previous studies or the observation, when we saw the top needs of the patient, we saw that being free of itch was mandatory or the first request of the patient. And so this will lead us to highlight that JAK inhibitors, such as baricitinib, are fast-acting therapies that can relieve itch and the treatment which is most valuable by the patient with atopic dermatitis. In BREEZE AD7, 44 on Olumiant in combination with topical steroid has a significant improvement in itch by week 16. So they went for further to identify who are the subgroup of patients who are more eligible or will get the most benefit of 4 milligram plus topical steroid. So in a post hoc analysis where a machine learned from framework was used to identify subgroups of patients most likely to benefit from baricitinib 4 milligram in combination with topical corticosteroid. From the study, we saw that the response to baricitinib 4 milligram at week 16 was defined as achieving EASI 75 or achieving 75 and relief of itch by having NRS 4 or more points improvement from baseline. So by artificial intelligence, they defined as predictor the body surface area. So they take the body surface area and they divide it into two groups, those who are below 40, 10 to 40%, and those who are above 40%. And they added to it the itch intensity. So there are patients who have itch NRS more than 7 and below 7. And they divided them into 4 groups. The first group are the patients who have body surface area 10 to 4% and itch less than 7. The second group, they have body surface area more than 40% and itch more than 7. And the third group is body surface area between 10 and 40%, but they have itch NRS more than 7, and they dominated them as itch dominant subgroup. And the last group is body surface area more than 40 and NRS more or equal to 7. So why is this analysis? As I mentioned, to decide which group will benefit more from baricitinib 4 milligram with topical steroid. Of course, all the other groups will benefit and will show improvement. But if I can say, who is the ideal to receive 4 milligram baricitinib and topical steroid? So from the study, they put baseline body surface area and itch severity, define response to baricitinib in patients with moderate to severe atopic dermatitis. They found that body surface area 10 to 40 and itch NRS 7 and more, which are the itch dominant group, they showed marked improvement at week 16. And using a machine learning approach, patient with body surface area affecting 10 to 40% and itch NRS 7 and more, which are the itch dominant, were characterized as likely to benefit the most from baricitinib 4 milligram and topical corticosteroid combination therapy. So to conclude all this, itch is the leading symptom in atopic dermatitis. Itch relief is the treatment effect most valued by patient. JAK inhibitors, such as baricitinib, are fast-acting therapies that may relieve itch, and the treatment which is most valued by patients with atopic dermatitis. So patients with moderate to severe atopic dermatitis who were characterized to benefit most from Bari 4 milligram and topical corticosteroid therapy were those with baseline 10 to 4 or 40% or less, and those with severe itch, which NRS 7 and more, and the response in itch dominant subgroup at week 16 is that 69% of patients achieved EASI 75 response, and 58% of patients achieved an NRS improvement of 4 or more point response. So that was about atopic dermatitis, baricitinib in treatment of atopic dermatitis. And as I mentioned, it has been approved for the pediatric from age 2 to 12, and also in adults 18 and above who are having moderate to severe atopic dermatitis and are eligible for treatment with systemic therapy. The second part of the presentation will be about Olumiant as a new down for the treatment of Alopecia areata, and till now it is the first treatment that's been approved for treating of Alopecia areata in adult patients. What is the efficacy of baricitinib in Alopecia areata? Olumiant has been evaluated for the treatment of adults with severe alopecia areata in 2 trials, conducting in 10 countries, and both are known as BRAVE AD trials 1 and 2. And in this study, it was evaluated at 36 weeks and then at 52 weeks. The patient, after a wash period, they were put into 3 arms. One is placebo, the other one is Olumiant 2 milligram, and the third arm was Olumiant 4 milligrams. After 36 weeks, the placebo group was shifted to either 2 milligram or 4 milligrams, and they were all investigated until 52 weeks. What are the eligibility criteria for this patient? The age is 18 to 60 in males and 18 to 70 in females. And hair loss duration or involvement should be more than 50% of the scalp, and this was measured by SALT score. And the current episodes of alopecia should be more than 6 months and less than 8 years. And now we can see what are the results, or what is the characteristics first of this. Most of the 1,200 patients enrolled in BRAVE Alopecia Areata 1 and 2 trials, they scored SALT score of more than 95%. And if you can see from these diagrams, you can see this is at week 0. In A, you can see SALT score is 56. B, SALT score is 67. So SALT score at 84, and at D, it is 89. And on baseline, they found that 61% of the patients were females, and the mean age was 37.5 years. The mean duration of the current episode was 3.9 years, and mean disease duration was 12.2 years. The mean SALT score, as I mentioned, it was above 95%, it was 96, and the affection of, or including of, having alopecia in eyebrows and eyelashes wasn't there in 69% and 58% of patients. The more than 90% of these patients, they were exposed to more than one treatment, and more than 50%, they had systemic treatment for alopecia areata. So from the study, or from both trials, there were a greater proportion of patients on Olumiant who achieved a SALT score of 20% or less and 10% or less at week 36 and 52 versus placebo. And we can see here, actually that 39% of patients on 4 milligrams, they showed SALT score 20 and less, and 28, they showed a SALT score of 10 or less at 52, but at week 36, it was 34 and 29.9 in the dose of 4 milligrams. So in both trials, there was significantly more patients on Olumiant 4 milligram who achieved a clinician reporting outcome of eyebrows and eyelash 0 or 1 at week 36 versus placebo. And it was from these studies, it was noticed that regrowth of eyebrows is not affected by baseline scalp hair loss severity. So if you see in this patient, actually, patient with severe alopecia and baseline SALT score 50 to 95, the improvement of the clinic reported outcome for eyebrows was 34.2 at week 36, and for eyelashes, it was when the SALT score was higher at 95 to 100, the improvement in eyebrows 0 or 1, it was 32.3. So regardless of the scalp hair loss severity, the likelihood of achieving complete or nearly complete regrowth of eyebrows was similar. By week 36, nearly 50% of patients with a baseline SALT score of 50 to 95 achieved hair growth resulting in at least 80% of scalp coverage. And we can see also from the study that more than 1 in 5 patients with a baseline SALT of 90 to 100 achieved scalp hair regrowth by week 37. Higher response rate, SALT less than 20 or 20 in patients with the duration of the disease episode less than 4 years, post hoc analysis. Actually, they noticed that if the duration of the disease was less, then the response will be more and better in patients with alopecia areata. And numerically, higher treatment responses was observed in patients with shorter duration of the current episode, and this means early intervention may convert greater treatment efficacy among baricitinib treated patients. So, among patients with severe alopecia areata who were to continue the treatment at week 52 and they were responders, approximately 9 out of 10 sustained their clinical meaningful scalp hair growth through week 104. So proportion of patients on week 52 responders who achieved SALT score less than 20 and less than 20 throughout week 104, and they were around 91% of these patients who sustained this excellent actually and very convenient response to the patient. If we go for the eyelashes and eyebrows, we can see that patients who were responding at week 52, then they kept on having the complete or nearly complete eye growth and eyelashes with Olumiant at week 104, and it was better even than at week 52. So we can see for eyebrows, patients who were on 4 milligrams in orange and 2 milligrams are in blue. Patients who were responding 70% at week 52 for eyebrows, they showed 84% at week 104, and those on 2 milligrams showed 60% improvement at week 52. They showed 68% improvement at 104. For eyelashes, those who are, they were on 4 milligrams, they showed 71 improvement at week 52, and they jumped to 81% improvement at week 104. While those who were on 2 milligrams, they showed 57% improvement at week 52, and on 104 week, they showed 73% improvement. So again, we have, whatever the medication, we have to check and see the safety of the medication in the treatment group. For integrated Olumiant safety analysis across alopecia areata patients, the adverse effect was minimal, and most adverse events were mild to moderate and easy manageable in a clinical practice. So, treatment emergent adverse events of special interest were of infections, non-melanoma, or MACE. All were actually either none or very minimal in patients with alopecia areata treated by Olumiant. Of consideration that there is no increases in adverse events were observed with long-term therapy. So what are the practical cavities in Olumiant? Olumiant and how to take it for alopecia areata. It is recommended dose 4 milligram once daily. When we need to give 2 milligrams just in a special consideration for those who have a chance or history of having venous thromboembolism or MACE or any malignancies, and in patients who are aged more than 65, and with a history of chronic or recurrent infections. or also patients who are taking organic anion transport inhibitors such as rifampicin, and when patient having creatinine clearance between 30 to 60, and these patients, when their medical condition is being cleared, they can go back again for 4 milligram of baricitinib. It has been taken once daily and can be taken with or without any food. When you will consider that medication is not effective, well, you should keep the patient at least a trial of 36 weeks before deciding whether this patient can stop or continue the medication. What are the treatment initiation or baseline blood to be done? Again, it is the same across all indications for baricitinib. This includes TB screening, hepatitis screening, CBC and differential, hepatic enzyme, ALA, ALT and AST, lipids, and renal function in the form of creatine clearance. And whenever a patient have any abnormalities, should be sent to the specialty concerned, especially hepatogastrology. And once the things are over, you can initiate the treatment again. So, Olumiant is the first approved treatment for severe alopecia areata in adult patients. It showed significant scalp hair regrowth that lasts versus placebo. There was significant eyebrows and eyelashes regrowth versus placebo. It has well-established safety profile across all indications. It is taken once daily oral tablet. And that will end my presentation about alopecia areata, and I can open for any questions from the audience. Thank you.